My name is Tina Ong. I have 3 kids, Peyton, Talon, and Easton. My second pregnancy with Talon, I was 34 weeks when I found out that he was going to have Down syndrome. When you get that real diagnosis, it's scary, very scary. When Linda came into my life, she introduced herself and let me know that she was here to help.
I'm a registered nurse working at VNA for the last 33 years. I am an early intervention service coordinator.
She really, from that initial phone call, made me feel amazing. She took some of the pressure of having a child with Down syndrome off, and she was one of the first people that treated it as if it was a positive thing and not such a negative thing. He was born and he, yes, was a beautiful baby. It was amazing, but it was scary. Here he is, and you see it for the first time. Scary, scary.
She just was uncertain as to how to proceed. What do I do? Where do I turn?
Through Linda and the VNA, I was able to get the therapist to come into my home and help my son.
The time that you're spending with them is truly the special time. It's a chance to get to meet, talk to them, hear what's going on. It's the best part.
The VNA is an extraordinary company, and it's made up of people who all work together and try to strive to integrate services.
I found out that I was pregnant with my 3rd child, and I was, I think, 7 weeks pregnant when I got the results from that. My 3rd son would also have Down syndrome. I couldn't believe it. I was completely in shock. And I knew that there was nothing that I can do about that because I had Talon, and he was fine, and he was beautiful, and he was healthy. I called Linda, and she right away, "It's okay, Tina. Don't worry, we're gonna handle it. We handled everything with Talon, we're gonna handle everything with this new baby." It was always that we're gonna be okay. It was almost as if she was part of the responsibility of making sure these kids are okay.
She had so much more knowledge about Down syndrome, what types of interventions to put in place.
When Easton was born, he needed to have surgery, so he had the colostomy bag put in. The VNA set up nursing for that.
The Children and Family Health Institute is 20 different programs. We may have a pregnant mom in our program. We may have the VNA's home care seeing a grandma who's had surgery. We may have an uncle who's in our HIV programs. And so we're seeing multiple family members.
When Talon became school age, Linda actually met me at the school. She knew Talon, and she knew that this was a great fit for him. Linda, she's always been a friend. She's always been someone that's supportive and there for me. Family, you know.
To watch them grow, to have that confidence and be able to advocate for their child, that's very rewarding.
I could have never gone through this experience without her. Definitely not. Clearly, my boys could never be where they are today without the practices that were put in place, initiated by her.
I learn from them how they are able to move on and handle whatever situations are given. It feels good.
It's important for people to donate to the VNA, and without that financial support, these kids, not just mine, but all of these kids, couldn't be where they are today. They're doing fantastic. They're learning and they're growing, and they're both in school full-time. I've never doubted their capabilities, but I never thought that they would be where they are today. It's amazing to me. It is truly amazing.